initial views for the elbow, and we're going to start with Jones, which is a acute flexion position for the olecranon. So we want the central ray to go directed perpendicular to the humerus, approximately 2 inches superior to the olecranon process through the center of the receptor space. And we want to collimate around the forearm and the humerus that should be superimposed with no rotation. And we want to see the olecranon process. Its soft tissue and distal humerus should be visualized in this image. So the second one that we're going to be doing is going to be the elbow acute flexion position, but for the ulnar sulcus. So it's going to be something like this. We want the central ray to be directed perpendicular to the humerus, approximately 2 inches superior to the olecranon process through the center of the receptor space. And we want to collimate around the forearm and the humerus that should be superimposed with no rotation. And the olecranon process, its soft tissue and distal humerus should be visualized. So the next one that we're going to do is going to be the Holy, which is a method special for examinations, and when the patient cannot extend the elbow. So it's going to be an image like this, and under here we're going to have some type of pillow to support the arm, and we want the central ray to be directed perpendicular to the elbow, and we want to collimate around an AP projection of the distal humerus and proximal radius and ulna in 2 separate exposures. So the next one that we're going to do is the coil. We have 2 views for this one. The first one is like this. The first one is like this. And this one is to look at the radial head and the capitulum. And the other one is like this, to look at the coronoid process and the trochlea. So we want the central ray for this images to go through the elbow at 45 degrees. And we want to collimate around the radial head and the capitulum and the coronoid process and the trochlea.